This is our presentation on the arteries of the upper limb, featuring the arteries of the upper limb and Artie the blood drop, who will move through them.
Arteries carry blood away from the heart. With the exception of the pulmonary arteries, they carry oxygenated blood away from the heart and out to the rest of the body via the systemic circulation. Blood is pumped from the heart into the large elastic arteries, which branch repeatedly to form many progressively smaller arteries. Arteries are generally grouped into different types, muscular and elastic, depending upon the relative composition of elastic and muscular tissue. Larger arteries are generally elastic, and smaller arteries tend to be muscular.
The main arteries of the upper limb are the subclavian, axillary, and brachial arteries. They form a continuum rather than a branching system, as the subclavian artery moves laterally across the body to become the axillary artery at the underarm, and then the brachial artery in the arm, which is the main source of blood for the arm. The subclavian artery arises from the brachiocephalic trunk on the right side to form the right subclavian artery, and directly from the arch of the aorta on the left side to form the left subclavian artery. The deep brachial artery arises from the posterior and lateral part of the brachial artery and runs in the radial groove. It supplies the tissues of the arm and humerus and terminates by contributing to a network of vessels at the elbow. The brachial artery descends down the arm and bifurcates at the inferior part of the cubital fossa, which is the triangular area on the anterior view of the elbow. The pulse of the brachial artery is palpable on the anterior aspect of the elbow, and with the use of a stethoscope and sphygmomanometer is used to measure blood pressure.
The bifurcated arteries formed from the brachial artery are the deep ulnar artery, which supplies the anterior aspect of the forearm, and the more superficial radial artery, which supplies the posterior aspect of the forearm. The radial and ulnar arteries reconnect in the hand to form the deep palmar arch and the superficial palmar arch, both from which branches to the digits emerge. The deep palmar arch is formed predominantly from the radial artery and contributes to supply of the thumb and lateral side of the index finger. The superficial palmar arch is formed predominantly from the ulnar artery and mainly supplies the medial side of the index finger and the rest of the digits. The hand has a very good blood supply with many superficial arteries that allow for heat loss when needed.